Well, your patient won't be able to, if you do have some damage secondary to the scalding hot water, well, your blood vessels and nerves are damaged, so you're not going to be able to send enough white blood cells, enough red blood cells to fix the issue. And that's when patients develop secondary infections. And eventually, the patient will develop a chronic infection like gangrene, and they're gonna need an amputation or debridement of any of those tissues. And that's how you have patients that develop the amputation of their toes or the amputations of their foot or more, below the knee amputations, because of this issue, because of this implication of damaged blood vessels and nerves, neuropathy, okay, and arteriosclerosis. So we could also develop things like CVA, cerebrovascular accident, a stroke. These patients are going to be prone to developing these macrovascular issues. They also may develop microvascular issues such as retinopathy. The patient that has consistent hyperglycemia, they're going to have a hard time with the blood vessels and capillaries that are in the retina and the entire vascularization of the blood of the eyeballs. And because of that, they'll go blind. You could also develop end-stage renal disease because of diabetic nephropathy. The glomeruli become damaged. And it's the same concept, guys. Ketones, hyperglycemia, all of those elements destroy blood vessels and nerves. And this is why your patients that have diabetes, we must control that glucose. We must ensure that we prevent issues where their blood glucose levels are consistently really high. And one of the lab values that we can look at to assess that is your hemoglobin A1C value. Now your hemoglobin A1C, imagine it being your little red blood cell, right? Have you heard the saying, if you lay with dogs, you'll get up with fleas? Well, if your blood cells are consistently around a lot of blood sugar, well, eventually they're going to develop this little protein, this little marker that lets us know that the blood cells are consistently around high glucose levels. And that's what your hemoglobin A1C is. Generally speaking, for your patient who is diabetic, we must keep that percentage less than 7%. That's how we know that the patient has proper glucose control. For your non-diabetic patient, less than 6. But your diabetic patient has to be 7 or less than 7. That's how we know that the glucose control has been good. And keep in mind that this hemoglobin A1C can look at the glucose control for up to 12 weeks before the day that you actually assess the value. So it does really look at the comprehensive glucose control from the past 3 to 4 months, 12 weeks. So keep in mind that we use that diagnostic tool as well. Okay, clear this up real quick. And I believe that pretty much sums up what I wanted to cover, guys. Please follow me on Learn NCLEX Now. Please subscribe to my YouTube channel and follow me on TikTok and Instagram and all that stuff. Thank you, guys.